Hello everyone, we are Group 14. The members of group are Anita, Harneet Kaur, Harpreet Kaur, Jasmine Kaur and Robindeep Kaur. And today we are going to present the weekly deliverable 1 to 5.
Hi, myself Jasmine Kaur, and today I am going to explain weekly deliverable 1. Mr. Stanley Lundborg arrived to the hospital with the breathing difficulties, hypertension, and COPD. During his stay in the hospital, he acquired the disease condition of deep vein thrombosis. It is expected because of the carelessness of the admitting physician. The physician was more attentive on dealing with his current symptoms. The physician forgot to prescribe the prophylaxis of DVT, that is blood thinners, as usually patient admitted to the hospital receive this treatment. This mistake caused harm to the patient as he developed DVT. The healthcare team should communicate actively and discuss the case regularly to check if anything was missed. If there is a good conversation among all health departments, proper diagnostic tests and history taking, this will help prevent the occurrence of deep vein thrombosis.
Hello everyone, this is Robindeep Kaur and I am going to explain the weekly deliverable 2. In this case, Mr. Lundberg suffered from the seizure, impaired kidney dysfunction and blood clots. Due to the kidney dysfunction, intravenous medication is given to treat the blood clot, which increased the patient's stay in the hospital. On the 8th day in the hospital at 10 p.m., the patient fell from the bed and the housekeeping staff notified that and they immediately called the healthcare team. Then the healthcare team member determined the seizure activity of the patient. Firstly, the healthcare team administered the IV medication to stop the patient's seizure activity. Secondly, to determine any injury and internal bleeding in the brain, they conduct CT scan of his head because no one noticed the fall down of the Mr. Lundberg. When the mental condition of the Mr. Lundberg stable, he complained pain in his left shoulder and elbow. To find out any fracture in his shoulder, they performed an X-ray which revealed no evidence of fracture. After that, the overnight staff nurse find out the cause of the seizure. She noticed that one of the patient's seizure medication, levetiracetam, had not been administered due to the unavailability of that medication in the stock. It concluded that the lack of communication between the physician and the healthcare team, because the nurse didn't notify about that to the physician and even to the pharmacist.
Hello everyone, my name is Anita. I'm going to present weekly deliverable 3. In this given case study, Mr. Berkman, who had colon surgery, complained that she gets high insulin. After examination, it was seen that the nurse administered 80 units of insulin. However, the doctor prescribed only 8 units. It implies that the nurse had made the medication error. She has been given an extra amount of insulin. Along with this, she did not assess the medication chart for clarification. Moreover, the nurse did not acknowledge her mistake. Even patient complained about the high dose. It could cause more health complications.
Good afternoon, ma'am. I'm going to explain the weekly deliverable 4th. In this scenario, Rogers Young, who had a road accident and he also suffers from a femur bone fracture. Also, Rogers' friend Joe was also admitted to the hospital as he has right hemisphere cerebrovascular accident and having urinary tract infection. Rogers often take care of his friend and provide him help in moving and moreover he was also suffering from ESBL. This comment was unnoticed by staff members and Rogers continued to provide help him. Rogers' girlfriend Donna visits Rogers frequently and they have intimate relationship with each other. Few days later, Donna was tested positive for ESBL after complaining for urinary tract infection.
Good afternoon, ma'am. Myself, Nit Kaur, and I am here to presenting the weekly deliverable 5. In this case, John admitted to the hospital with severe pain and referred to the orthopedic surgeon. After CT scan, physician observed some activities in patient's femur and referred to the oncologist as there were symptoms of tumor. However, when the biopsy done, they did not find cancer. It indicates the incorrect patient diagnosis. Although physician take action immediately, but he failed to make an accurate diagnosis that can affect patient's mental health. Even physician did not notice that patient has good activities rather than hip pain and reached to the final decision without getting any lab reports. Thank you.
Ma'am, myself Anita, I'm going to present weekly deliverable 6. The application of best medical record system was brought up in the hospital to incorporate it with electronic medical record, as the government has incentivized the exercise of electronic medical record in hospital headquarters. It was presumed that employing electronic medical record can profit healthcare worker and organization. Nevertheless, the implementation of best medical record system leads to a terrible outcome. The hospital has created a best medical record system that is suitable for primary care practices but unsuitable for specialty practices. Due to the complication, the length of specialized assignment, production, and efficiency was negatively impacted. Moreover, even after being made aware of the problem faced by the experts, the revenue loss and the patient unhappiness brought up on the by installation of best medical record system, the administration that makes up the central committee is still recalent to create the essential improvements. Thank you.
Good afternoon, ma'am. Myself Aneet Kaur. I am here to present weekly deliverable 7. Sunnybrook Hospital is the largest community hospital and has an extensive dialysis program. Mr. Conniff was admitted to the hospital in a dialysis center where doctor sent him to pre-operative room before the surgery. The patient had not been dialyzed from many days and suffering from the severe pain. When a nurse reviewed his lab reports and identified that patient has high potassium level and she cancelled the surgery immediately without informing physician. However, physician get furious with the decision. After the long discussion, it was concluded that they are going to perform the surgery to decrease the potassium level of patient. This situation indicates the poor collaboration between healthcare members and the lack of knowledge among nursing staff. Thank you.
Good afternoon, ma'am. I'm going to explain the weekly deliverable 8th. In this scenario, Aboriginal woman who is diagnosed with an advanced case of breast cancer. Mastectomy was suggested to cure it. Because of a language barrier, bilingual janitor was appointed who translated all the medical procedure to the patient, but the patient failed to understand all the procedure. Because of a language barrier, patient is unable to understand, but she signed the consent form and doctor performed the surgery. Like after surgery, when patient came to know that her breast is removed, she got very angry, and all this situation is happened due to the like untraining of the interpreter, so that the manager should provide proper training to the interpreter so that they explain all the necessary things to the like patient.
In weekly deliverable 8, case 2, which implied the cultural disparity between Jewish patient and the physician, a 36-year pregnant Orthodox Jewish woman had 10 children visit to gynecologist. Patient's husband is in examination room with her wife and he answers physician's question. Patient diagnosed with varicose vein because of hormones of pregnancy. Doctors suggest that it will cure when she will know pregnant in future. Patient's husband get enraged because he feel like doctors intruded in their family planning. Conclusion: in both the cases, a communication gap produces an adverse reaction from the patient and family. There should be a various method that should maintain communication between the patient and family.
Weekly deliverable 9. It has two scenarios. The first scenario is a large hospital creates strategy to disseminate its new values-based vision. Hospital designed a piece of jewelry, a pin to symbolize core values of their vision. The group members will pin two members who are out of organization. They will narrate a story to pin person that demonstrate the core value and further encourage them to pin the other two members, provide pin and card to the individual as well to continue the practice. This will result in faster incorporation of moral values. These moral values will be quickly embedded to the mass of people if this procedure is followed.
Good afternoon, ma'am. Myself Aneet Kaur. I'm going to present scenario 2. The hospital was performing poorly in the particular area. The hospital leaders conducted a meeting to let the manager read the morning headlines of the newspaper. It was written that poor performing area of the hospital will be closed. This was later revealed that it was a prop, not a real. The corporate leaders just want to teach the manager the lesson to promote productivity and efficiency in the poor performing areas. Thank you.
Weekly deliverable 10. South Medical Center is the 500-bed hospital that provides outstanding emergency care to victims of accident and violence. SMC only had one male physician as its CEO. Dr. Jones, who had held the position of CEO, is now planning to retire from the job. Work start on inquiry with the expected set of responsibilities improvement, which required a carefully prepared doctor chief with president experience. The Board of Trustees has limited the candidate pool to 6 finalists with whom the council will hold interviews. None of the leftover candidate is Chinese. This information is leaked into the press and became the headline on the front page of the newspaper. The article point out the important problems. First one is lack of Chinese representative and second one is lack of transparency. The highly qualified Chinese physician with CEO experience had held dropped from applicant pool.
Good afternoon, ma'am. My name is Anita. I'm going to present weekly deliverable 11. In this case, it is concluded that the shortage of healthcare workers is one of the major issues in Canada. Some people believe that it is due to the policies that were implemented in 1980s and 1990s. Whereas other people think that strict policies provide a license to immigrant and hard admission criteria for citizens of Canada. Other countries are less selective in their admission process, and that's why people are studying in medical field in other countries. The anxiety of COVID-19 and increased work pressure have direct to elevated rates of retirement and resignations. To get rid of their problems, government has directed to elevated rate their retirements and resignations. Thank you.
Good afternoon, ma'am. I'm going to explain the weekly deliverable 12th. In this scenario, the chef of the medicine at the Central Margaret Hospital was an unfit leader who is unable to lead the hospital. He was a very lazy, unfaithful, and incompetent physician. John and his all colleagues were unhappy from him, and they reported the deficiencies of chef behavior to the head of department. Therefore, the chef was transformed to a small hospital in England. After 3 years, John has an encounter with chef, and he shows his gratefulness toward John. He is gratified from his work. Now he is working at administrative level in the hospital. The John and his colleagues complained supported the chef to discover a more appropriate job. Now he enjoyed his work. In the chef place, a more suitable leader was appointed who was more capable of handling the position. Thank you so much for listening.